If your blood pressure monitor ever shows a top number of 180 or higher, or a bottom number of 120 or higher, there is one thing you need to do before anything else, and most people get it wrong. Today, I am covering exactly what those numbers mean, the warning signs that mean you need emergency help right now, and what you should and should not do while you wait for that help to arrive. I'm Dr. Mandy Thomas. This video could genuinely matter in a moment of crisis for you or someone you love. Stay with me. Comment below. Do you have a blood pressure monitor at home? I read everyone. What 180 over 100 actually means. A reading of 180 over 120 or higher is defined as a hypertensive crisis, a level of pressure that requires immediate medical evaluation. A reading between 180 over 100 and 180 over 120 is called hypertensive urgency, which is serious but slightly less immediately dangerous. In both cases, the right move is the same. Contact your doctor or emergency services rather than waiting to see if it comes down on its own. High blood pressure at this level causes no dramatic warning symptoms in most cases. That is what makes it so dangerous. Your arteries can be under extreme pressure while you feel relatively normal, or you may feel a deep throbbing headache at the back of your skull, visual changes, or a sense of pressure in your head. These sensations are your body's signal that something serious is happening. Call first. Always. If you remember nothing else from this video, remember 4 words. Call, sit, breathe, wait. The most important thing I can tell you, if the top number is 180 or higher, or the bottom number is 120 or higher, the first thing to do is call your doctor or emergency services, not try a home remedy, not wait it out. Here is why professional assessment cannot wait. Depending on what is happening inside your blood vessels, the right medical response is very different, and the wrong intervention in the wrong situation can cause serious harm. That distinction requires clinical assessment that cannot happen at home. This is why calling immediately is not optional. Call 9999 in the UK, 911 in the US, or your local emergency number. Tell them your blood pressure reading and describe your symptoms. Do not drive yourself. Warning signs that mean call immediately. Do not wait. While any reading of 180 or higher warrants a call, certain symptoms mean you need emergency services right now without delay. Sudden, severe headache unlike anything you have experienced before. Not a typical headache. Sudden and severe. Vision changes, blurring, double vision, or loss of vision in one or both eyes. Weakness or numbness on one side of the body, in the face, arm, or leg. Facial drooping, particularly on one side. Sudden difficulty speaking or understanding speech, sudden confusion or disorientation, chest pain or pressure, difficulty breathing. These are signs that blood vessels may already be under critical stress. Every minute matters. Call immediately. Now I want to pause. Every week I break down one cardiovascular topic that directly affects heart health after 60. Subscribe right now and turn on notifications. And share this today with a senior you care about. What comes next is the part most people have never been clearly told. What to do while waiting for help. Once you have called for help, there are things you can do while you wait that support rather than worsen the situation. Sit upright with your back supported and feet flat on the floor. This is the position paramedics use for cardiovascular emergencies. It allows gravity to work in your favor rather than against you. Do not lie completely flat. Do not pace or move around unnecessarily. Breathe slowly and deliberately through your nose. Rapid, shallow mouth breathing expels carbon dioxide too quickly, causes blood vessels to constrict, and activates the stress response, all of which worsen elevated blood pressure. Slow nasal breathing has the opposite effect. In through your nose for 4 counts, hold briefly, out through your mouth for 6 to 8 counts. This directly calms the nervous system and can help reduce the stress response while you wait. Stay calm and still. Do not attempt strenuous activity. Do not attempt to drive. If someone else is with you, have them stay close and keep you company. What not to do. Do not take aspirin unless specifically instructed by a medical professional. This is important. Aspirin is appropriate for some cardiovascular emergencies, but not all. At very high blood pressure levels, there is a risk of a hemorrhagic event, where a blood vessel ruptures rather than clots. Aspirin prevents clotting. In that situation, taking aspirin without knowing which type of event is occurring can cause serious harm. Leave that decision to the paramedics or doctor who can assess you properly. Do not consume caffeine. Coffee, strong tea, and cola are vasoconstrictors. They cause blood vessels to narrow, which is the opposite of what you need. Do not add sodium. Salty snacks, crackers, cheese. Anything high in sodium causes the body to retain fluid, which increases blood volume and pressure. Avoid them. Plain water in small, calm sips is fine and supports kidney function. How to be prepared before a crisis happens. And this is the part most people never think about until it is too late. The most powerful thing you can do is prepare before a crisis occurs. Most people who face a hypertensive crisis at home are caught unprepared. They do not know their baseline readings and they cannot remember their medication names when paramedics ask. 3 things to do this week. Keep a blood pressure log. Morning and evening readings, taken after 5 minutes of rest. Know your medications by name. Keep a written list with doses and timing in your wallet, your phone, and on your fridge. And know your normal. If your usual reading is 125/80 and it suddenly jumps to 165, that is a different conversation than someone whose baseline has been 150 for years. Your doctor can help you understand what range is concerning for your specific situation. A word on rechecking readings. If you take a reading and see a number that alarms you, take a second reading after 5 minutes of quiet rest. A single reading can be elevated by anxiety, recent activity, caffeine, or even the stress of seeing a high number on the screen. 2 or 3 readings averaged over 5 to 10 minutes gives a more reliable picture. If the reading remains consistently at 180 or higher, call. If the reading drops significantly with rest and you have no symptoms, still contact your doctor that day. Do not wait until your next scheduled appointment. I've put together a free blood pressure emergency preparation guide, a 1-page printable I give my clinic patients covering the warning signs that require immediate emergency contact, the do's and don'ts while waiting for help, and the preparation checklist to have in place before a crisis happens. Print it and keep it somewhere visible in your home. The link is in the description. Drop a comment below. Have you ever seen a reading that alarmed you and not known what to do? I read every one. Every week, I break down one heart health topic that doctors wish more people understood. Subscribe if you haven't. Share this with a senior you care about. This is one video that is worth having seen before you ever need it. Next video, the daily habits that prevent blood pressure from reaching crisis levels in the first place. The 10 evidence-based strategies that move the numbers before they become an emergency. I'll see you there. This video is for educational purposes only and does not constitute medical advice. If you are experiencing a blood pressure reading of 180 or higher, or any of the warning symptoms described in this video, contact emergency services or your healthcare provider immediately. Do not rely on this video as a substitute for professional medical assessment.